It's a frustrating reality many men face as they get older. That ability to just get things working like they used to. Maybe it takes longer. Maybe it's not as firm. Maybe it just doesn't happen at all sometimes. It can feel like your body is letting you down, and it's easy to blame age, stress, or just general wear and tear. But what if I told you there's a very common, completely private habit that many men unknowingly fall into? Something they might have been doing for decades. That could be a significant silent culprit behind their struggle to get and maintain an erection. It's a sensitive topic, I know, and not one easily discussed. But as someone who has spent years working with male anatomy, I've seen the subtle, long-term effects of this one particular mistake. It's something you might not even realize you're doing. A specific way of seeking release that over time can desensitize and even damage the very tissues needed for a strong erection. It's not about whether you masturbate or not. That's a personal choice. It's about how it's done. In this video, I'm going to explain exactly what this common mistake is, why it's so damaging, and most importantly, what you can do instead to help protect and even potentially improve your erectile function. This is crucial information for any man wanting to maintain his sexual health as he ages. Watch to the end for something that will surprise you. So let's talk about this mistake. It often starts innocently enough, maybe in younger years, and becomes a deeply ingrained habit. It's a specific technique used during masturbation, one that prioritizes speed and intense friction, often involving a very tight grip and vigorous up and down strokes. Think about it. For many men, the goal is a quick, intense orgasm. And this method often feels like the fastest route there. It replicates, in a simplified way, the kind of intense pressure and friction that can be applied. The problem is, the penis is a delicate organ, filled with sensitive nerves, blood vessels, and spongy tissue designed to fill with blood. When you apply excessive, prolonged, and repetitive tight friction using a dry hand or minimal lubrication, especially with that firm grip, you are essentially subjecting these delicate structures to significant stress. Over time, this kind of aggressive technique can lead to several issues. One of the primary problems is desensitization. The nerves in the penis, particularly the glands, are incredibly sensitive. Their job is to pick up subtle sensations and send signals that contribute to arousal and ultimately orgasm. When these nerves are repeatedly bombarded with high pressure, high friction stimulation, they can become less responsive. It's like trying to hear a whisper after standing next to a loudspeaker for too long. The subtle signals get lost. This desensitization means that when you are with a partner, the natural, gentler stimulation might not be enough to trigger the necessary arousal response needed for an erection. The penis has become conditioned, in a way, to respond only to that specific, intense, high-pressure technique, making it harder to get and maintain an erection with partner sex. Beyond desensitization, there's also the potential for microtrauma. The skin and underlying tissues aren't designed for that kind of relentless, high-friction abuse without adequate protection or lubrication. Think about rubbing your hand raw. The same kind of damage, albeit often microscopic, can happen to the penile tissue and blood vessels over time. This repeated microtrauma can contribute to fibrosis, which is a thickening and scarring of connective tissue. This scarring can affect the elasticity of the penile tissue, making it less able to expand fully when blood flows in, which is essential for a firm erection. It can also potentially damage the small blood vessels themselves, further impairing blood flow. It's a slow, silent process, often happening over years or even decades, which is why many men don't connect their current difficulties with a habit they've had since youth. They might think it's just age, but this specific technique has been contributing to the problem all along. The key takeaway here is that it's not the act itself that's the issue. It's the method. That tight, dry, high-friction approach is the culprit. It conditions the nerves for extreme stimulation and can cause gradual physical damage. The good news is that understanding this is the first step, and there are absolutely healthier ways to approach masturbation that don't carry these risks and can actually be more pleasurable and sustainable for long-term sexual health. The goal isn't just orgasm. It's maintaining the health and responsiveness of your body so you can enjoy intimacy in all its forms. Now that we've discussed this specific harmful technique and why it causes problems like desensitization and tissue damage, let's look at what you can do differently. Healthier alternatives that protect your function. Moving on, let's talk about those healthier ways to approach this. The fundamental shift is moving away from that tight grip and high-friction technique towards something gentler and more varied. More akin to how stimulation happens naturally with a partner. This means incorporating lubrication. Using a good quality water-based or silicone-based lubricant is absolutely essential. It drastically reduces friction, protecting the skin and underlying tissues from that damaging rubbing. It allows for smoother, gliding strokes rather than abrasive ones. Think of it like greasing a moving part to prevent wear and tear. Lubricant does the same for your delicate anatomy. Don't be shy about using enough to ensure a smooth glide. Experiment with different types to find one you like. Another crucial change is varying your grip and pressure. Instead of that vice-like hold, try a looser grip. Explore different levels of pressure, from very light touches that focus on stimulating the glands and shaft surface, to firmer, but not painful, pressure. The goal is sensation, not just intense pressure. This helps prevent the nerves from becoming desensitized to anything less than extreme stimulation. Also, vary the stroke pattern. Instead of just vigorous up and down motions, try circular motions around the head, focusing on the frenulum area underneath, or stimulating the shaft with a more rolling motion. Explore different speeds and rhythms. The idea is to use a range of sensations, mimicking the variety of touch and pressure you might experience with a partner. This helps keep the nerves responsive to different kinds of stimulation, making it easier to get aroused in different situations. Think of it as retraining your nervous system. If it's only ever learned to respond to one very specific, intense type of stimulation, it becomes limited. By introducing variety in pressure, speed, and motion, and by using lubrication, you are teaching your body to be responsive to a wider range of sensations, which is crucial for partner sex. Making this change isn't just about preventing future problems. It can also help reverse some of the desensitization that may have already occurred. By backing off from the aggressive technique and introducing gentler, more varied stimulation, you give those nerves a chance to recover and regain some of their natural sensitivity. It takes time, often several weeks or even months of consistent practice with the new techniques. But many men report a noticeable improvement in their ability to respond to less intense stimulation, including during intimacy with a partner. It's also important to pay attention to your body. If you experience pain, soreness, or irritation, you are likely being too rough or not using enough lubrication. Back off, use more lube, and be gentler. Listen to the signals your body is sending you. Another aspect is frequency. While masturbation itself isn't inherently harmful, if the method used is damaging, then frequent use of that method exacerbates the problem. If you've been using that tight, dry, high-friction technique daily, reducing the frequency while you transition to a healthier method can also help your tissues recover. It's about quality, not just quantity, of stimulation. Switching to these healthier techniques isn't just about avoiding harm. It can actually enhance your pleasure. By using lubrication and varying stimulation, you can discover new zones of sensitivity and enjoy a wider range of sensations beyond just the push towards orgasm. It can make the experience more sensual and less purely focused on intense friction. So, to recap this part, the key is lubrication, varying pressure and grip away from a tight hold. exploring different motions, and being mindful of your body's signals. Making these changes requires conscious effort, especially if the old habit is deeply ingrained. But the potential benefits for your sexual health and your ability to experience intimacy are significant. Next, we'll dive into how these changes tie into overall sexual health and some practical steps to help you make this transition successfully, and what benefits you might expect. Now, let's bring this all together and talk about making this change stick and the broader picture of why it matters. Changing a deeply ingrained habit, especially one as private and routine as this, can be challenging. The first step, which you're taking right now by learning about this, is awareness. Recognizing that the way you've been doing things might be contributing to difficulties is powerful. Don't feel ashamed or embarrassed. This is a very common scenario I encounter. The next step is conscious effort and practice. It takes time and patience to retrain your body and mind. Approach it with curiosity and self-compassion, not frustration. Experiment with the new techniques, different lubricants, different levels of pressure, different speeds, different types of strokes. Find what feels good in a healthier way. It might feel different at first, perhaps less intensely focused, but aim for pleasure and sensation over sheer, forceful friction. Consistency is key. Try to commit to using the new techniques exclusively, even if the old habit feels more immediately effective for achieving orgasm. In the long run, the gentler methods are about preserving function and enhancing pleasure both alone and with a partner. Consider incorporating fantasies or visual aids that enhance mental arousal alongside the physical stimulation. This helps ensure your brain is also engaged in the process, not just relying on brute physical force. This is important because arousal involves both the mind and the body. Focusing solely on intense physical friction can sometimes bypass the mental component, further reinforcing the need for extreme physical stimulation. By incorporating elements that stimulate your mind, you help keep the whole system responsive. It's also important to manage expectations. If you've been using the harmful technique for many years, it might take time to see improvements in your natural erectile function during partner sex. Be patient with yourself and your body. Small, gradual changes are more sustainable than trying to change everything overnight. Remember, this isn't a quick fix, but a long-term investment in your sexual health. Making this change can have significant benefits beyond just improved erectile function. It can lead to a more varied and nuanced experience of pleasure. It reduces the risk of physical irritation or soreness from aggressive friction. And perhaps most importantly, it can boost your confidence. Knowing that you are actively taking steps to address a potential issue and improve your body's responsiveness can alleviate some of the anxiety and frustration associated with erectile difficulties. It puts some control back in your hands, moving away from feeling like your body is just failing you. This change also aligns with the broader principles of maintaining health as you age, being gentle with your body, listening to its signals, and making conscious choices that support long-term well-being. Erectile function is closely linked to overall cardiovascular health. Good blood flow is essential for erections. So, while changing your masturbation technique is crucial, remember that it's part of a larger picture. Maintaining a healthy diet, getting regular exercise, managing stress, not smoking, and getting enough sleep all contribute significantly to erectile health. Addressing this specific masturbation mistake can be a powerful piece of the puzzle, especially if it has been a major factor in your personal history. Don't hesitate to seek medical advice if you have persistent concerns about erectile function. A doctor can help identify any underlying medical conditions that might be contributing and discuss other potential treatments if needed. But for many men, simply changing this one habit can make a noticeable positive difference over time. It's about treating your body with respect and care, recognizing that the pursuit of pleasure should not come at the cost of long-term function. So, we've covered a lot today about that common, often unseen, mistake during masturbation. The habit of using a tight, high-friction technique, often without enough lubrication. We've talked about how this approach can lead to desensitization of those vital nerves and even cause microscopic damage to tissues and blood vessels over time, making it harder for your body to respond normally and get a firm erection, particularly with a partner. And we've explored the healthier alternatives, embracing lubrication to protect your tissues, varying your grip and pressure to avoid that tight, forceful squeeze, and experimenting with different types of strokes and rhythms to keep your nerves responsive to a wider range of sensations. Remember, the goal is a more gentle, varied approach that prioritizes sensation and long-term health over just immediate, intense friction. Making this change is a process, requiring patience and practice, but it's a powerful step you can take to improve your sexual health and well-being as you get older. It's not about shame or judgment. It's about understanding your body and making informed choices to support it. Small changes truly can make a big difference to your health and happiness. And addressing this one habit could be a significant step towards regaining confidence and improving your intimate life. Don't underestimate the impact of seemingly small, private habits accumulated over many years. But also don't underestimate your ability to make positive changes at any age. Your body is resilient, and with the right approach, you can support its natural functions. I encourage you to try incorporating these gentler techniques. Be patient, be consistent, and listen to your body. You might be surprised at the positive changes you experience. If you found this information helpful, please let me know your thoughts or any questions you have in the comments below. Sharing your experiences, even anonymously, can help others who might be struggling with similar issues. And if you want more practical advice and insights on maintaining your health and vitality as you age, please take a moment to like this video and subscribe to my channel. Your support helps me create more content that can help men navigate these important, often unspoken, health challenges. Taking care of yourself, in all aspects, allows you to live your best life at every age.